So in this video, we are going to do a manual hemoglobin using a whole blood capillary sample from a finger stick. So the equipment that we're going to be using is the Hemacue hemoglobin analyzer, and this analyzer is a small handheld device that could be used as a point-of-care testing system. In order to make sure that our equipment is actually accurately testing, we are going to run 3 levels of control today. So the way that the Hemacue Hemoglobin 201 machine actually works is using a small micro cuvette. And this cuvette is designed to fill with 10 microliters of whole blood sample. And then the analyzer will test that sample using the absorbance of light to give a hemoglobin result. So the actual cuvette has an area at the end of it that has reagent that will mix with the blood sample before the testing occurs. I have 3 levels of whole blood hematology controls that we are going to test today, levels 1, 2, and 3. And so these 3 separate controls have different levels of hemoglobin within them, and we're going to test those first to make sure that the machine is accurately testing for hemoglobin. The normal ranges or expected ranges for each of these levels of hematology control are given with each box of control that you purchase. And so I have already recorded what those normal or expected ranges are for each of the controls that we're going to run today. So we're going to start with hemoglobin level 1. The first thing to remember whenever you are taking out one of these micro cuvettes is to not touch the tip where the sample is going to go. As I touch the sample to the end of the micro cuvette, you can see that it completely filled that end area with the whole blood control. We then simply place it into the analyzer, close the tray, and wait for our result. And the result we are given is 8.1 grams per deciliter hemoglobin for level 1. The expected range for this level that was given us was 7.5 to 8.3 grams per deciliter. So level 1 control is within its expected range. Now I'll simply complete the same process for levels 2 and 3. And the result that I got here is 12 grams per deciliter, also within the expected range of 11.3 to 12.5. Level 3 control. Is reading 16.5 grams per deciliter. The expected range for level 3 is 15.1 to 16.7. So again, we are within range for all 3 levels of our hemoglobin control. Now we're ready to test a patient sample. So the kit actually does come with an instructional guide on how to both collect the capillary sample from a finger stick and how to test it using the same micro cuvettes in the same manner that we used for our controls. So we'll follow the proper procedure for a finger stick sample collection. If you haven't watched the video on proper finger stick sample collection, you can pause this video and watch that now. I am cleaning the site and properly puncturing the finger using a lancet, and then I'm wiping away the first drop. In this test, it's very important to wipe away the first drop because there will be some fluid released from the skin cells themselves during the puncturing process, and we don't want that extra fluid to be added to our micro cuvette when we collect our sample. Then I'm simply going to touch the micro cuvette to the second drop of blood and place it into the analyzer. And the analyzer has given us a patient result of 14.8 grams per deciliter. So your assignment is to look up the normal or reference range for patients for hemoglobin. The results or the ranges that are given for men and women actually do differ for the hemoglobin test. This is how we do a point of care or rapid manual hemoglobin assay.